Sure. Good morning, Madam Chair and committee members. My name is Bridget Siljander. I'm a personal care attendant, PCA, the president of the Direct Support Professional Association of Minnesota, DSPAM, and the mother of a child who has cerebral palsy. I hold a bachelor's degree in psychology, summa cum laude, from the University of Minnesota. DSPAM is opposed to a number of the governor's recommended budget cuts to disability services and PCA services. My comments today will focus on the proposed changes to the PCA program. I am the face and the voice of one of thousands of PCAs in Minnesota. You probably won't see many of our faces or hear many of our voices because we are a marginalized and underrepresented workforce. Excuse me. DSPAM members believe that the PCA program can't afford cuts and PCAs can't afford reductions to their wages. As a PCA for over 10 years, I have barely survived on my wages while working numerous split shifts over the course of exhaustingly long workdays and spending hours daily in my car, driving between consumers sometimes up to 4 hours per day. Though I toiled and for a period of 2 years worked split shifts 7 days per week, I still needed subsidized housing, welfare benefits, trips to the food shelf, and Minnesota Care for myself and my daughter. It was humiliating for someone who prides herself on her self-sufficiency. I don't like getting public assistance. In fact, I hate it. But I was forced to make up for the gap between my earnings and the basic cost of living. I recall many times when preparing food for a consumer that I wished I could afford groceries. I want you to know that I'm proud of my work ethic and the standard of service that I provide. I am good at what I do, and through my advocacy, I am raising awareness that this work demands intelligence, talent, skill, and independence and problem-solving abilities. The governor's recommendation cuts more than $85 million in fee-for-service PCA services over 2 years, over the next biennium, rising to $75 million for 2012 and $81 million for 2013. These dollars will be removed from the economy. Since this industry is highly labor-intensive, many of these dollars will be taken out of the pockets of PCAs and other DSPs. People already struggling to pay for transportation, housing, food, utilities, and health care. People who put their dollars right back into their local communities. This seems contrary to efforts to stimulate the economy, empower individuals, and support each other. DSPAM opposes the governor's recommendation to eliminate eligibility for Minnesota Care, GAMC hospital only, and transitional Minnesota Care for adults without children. Because DSPs are low-wage workers, are more likely to take advantage of Medicaid-funded health care, and already lack access to affordable health care, this recommendation would further compound this problem. PCAs may provide health care services as a part of their job duties, yet they themselves are largely denied access. DSPAM opposes limiting the number of hours per month a PCA can work to 310 hours. This limitation will take away wages from PCAs who are already providing services in community and home-based settings. This limitation would mean that consumers would be forced to recruit additional staff. DSPAM does support the governor's recommendation requiring PCA staff to be trained on working with people with disabilities, infection control, mandated reporting, role of the PCA, basic transfers and lifting, changes in condition, and HIPAA. DSPAM supports requiring standardized training for agency owners and PCA staff, but DSPAM does not support additional training requirements without increases in wages. Requiring additional training could decrease competitiveness of PCA wages when a majority of DSPs do not earn a livable wage. The proposed budget changes to personal care assistant services will take money away from PCA wages, and this is an unacceptable solution to balancing the budget. Thank you for the privilege to offer my testimony.
Thank you.